what are the symptoms that you might have if you have intestinal cancer? Since the intestines are organs that are hidden inside of the body, and these types of cancer do not grow that rapidly, that fast, then symptoms are going to appear gradually, and you might not even notice them until definitely something is wrong. So the first thing that you might notice is that you're losing weight. Unintentional weight loss is definitely a symptom of many other cancers, but in this case of colorectal and intestinal cancer. Difficulty with your bowel movements, either because you have diarrhea or constipation, it's definitely a symptom. Of course, it is more related to colorectal cancer, and also if this is something of new onset. I mean, if this is new, you had regular bowel movements once or twice a day, and from certain point of time recently you started having difficulties, then that's something you need to get checked. The stool might give us certain signs that we have a problem, especially the shape. If you have a stool that is thin as a pencil or like stripes, it might be a sign that you have a mass that's actually narrowing the colon and creating that stool that is very thin. So that happens, especially if that's something new, that you need to get checked. Blood in the stool or as you wipe, it's also a sign of this. Not very, very specific to colorectal cancer or intestinal cancer, because there are more common causes for this sign. Hemorrhoids or fissures that we have in anal fissures, those are more common causes, but definitely you need to get checked because there is a possibility that blood might come from the stool. Now, it's important to know that most patients with cancer will have blood on their stool, but in most cases it will be microscopical. You will not be able to see it. But definitely if you are, then you have a very good reason to go to your doctor. If you have your normal bowel movements and you still feel like you have to go even when you just went to the restroom, or you feel like there is something there that it's bothering you, pressure, or you feel like there is a mass, of course you need to go, because that is a sign of especially rectal cancer. And last, but also present, I did it last because it's the sign that usually appears last, is the pain. Most people will develop pain later in time, but eventually it will appear. Some people describe it as a colic type pain. So it comes and goes, it's not necessarily there all the time. And the last one, which is vomiting, might be the actual emergency now, because when cancer grows so much that it occludes the intestine, well, of course, that food and all that feces will have nowhere else to go but go back. So if you start throwing up repeatedly, especially if that vomit looks like it might be feces, that's an emergency, because now that cancer would have occluded the whole intestine. There are some other causes for that to happen. Of course, that's an intestinal obstruction. It can happen because you had a previous surgery or some other reasons, but definitely, no matter the reason, this symptom needs to be checked to rule out many other things, being cancer one of those.